You would never guess where a heart stent enters your body. I used to think, no way they have to cut open my chest, right? The truth is, the doctor makes a tiny hole in your wrist. A catheter, even thinner than your blood vessel, quietly starts its journey from there. It travels up through the artery in your arm, winding its way along, and finally navigates precisely to the blocked coronary artery in your heart. Then comes the most amazing moment. A tiny balloon at the tip of the catheter gently inflates, pop. Like opening an umbrella, it expands the stent, instantly propping open the narrowed vessel. Mission accomplished. The catheter withdraws, leaving only the stent behind to guard your heartbeat. So why the wrist? Isn't that taking the long way? They choose this spot because the artery in your arm leads directly to the heart. It's less invasive, leaves no visible scar. Patients can get up and move around soon after the procedure, and the risk is very low. If the wrist route isn't workable, doctors have another option. They go in through the femoral artery in your groin. This traditional highway is wider and is the preferred choice for more complex situations. So, now you see? With 3D animations like this, we turn complex medical processes into clear and easy to understand visuals. We are a professional medical visualization team, specializing in creating custom 3D animation solutions for the healthcare industry.